Welcome in, everyone, to another edition of Tapping with Joan. Today, I have my special guest. Okay, I can do this. Judah Veitel. Did I get that
Veital. Yep,
right?
Veital.
Veitel. Okay.
Yep.
Who is a director of training with Nordic Naturals. And he has, oh my gosh, I'm going to read this again for anyone that missed the first podcast about fish oil and omega-3 fatty acids. So Judah has been, for the past 30 years, has been immersed in the study of interconnectedness of human physiology and the use of nutrition, nutritional supplements, medicinal plants, and natural remedies for health and healing. He is the program director, or has been the program director, for a functional medicine clinic, the nutrition and lifestyle coach for a direct primary care naturopathic medicine medical clinic, as well as the director of education and clinical consultant for various nutritional supplements. Judah has lectured throughout the US and Canada, created educational programs and protocols for medical professionals and nutraceutical companies, and has been a guide for people navigating complex health conditions. Folks, we are truly blessed. Currently, Judah is a clinical nutrition educational specialist for Nordic Naturals and is pursuing his MS in integrative and functional nutrition. I mean, everybody, you can't get any better than this. I'm just saying. So, this podcast is not meant to treat any particular condition. This is for informational purposes only. Please consult with your healthcare provider before using any of our ideas or suggestions. And with that, the topic of today's podcast is, what is functional health versus allopathic medicine? Because I'm just wondering how many people out there really know the difference between allopathic and functional.
Hmm.
Oh,
Yeah, functional medicine is a cresting wave, and it still has a lot of popularity to gain, in my opinion. It's gained tremendous steam. I've been involved with it since 2006, so going on, oh well, a long time, let's say. And and the thing that's fascinating about functional medicine is, and let's put integrative medicine in here too,
yes,
but
yes, functional integrative, yes.
functional integrative medicine is I think probably the biggest differentiating factor between integrative and functional medicine and allopathic medicine is that they are patient and relationship centered practices instead of condition-centered practices, right? So it's really taking the patient into consideration. The patient is of primary concern. The relationship with the patient is of primary concern. And so, and when that's the case, what happens is that you inherently have to take into consideration the whole human being. You have to take the body, mind, spirit, as well as community into consideration. And that's kind of the foundation of integrative and functional medicine. And so when we talk about, well, the whole human being, body, mind, spirit, so we're looking at genetics, we're looking at nutrigenomics, we're looking at, how dietary chemicals, nutrients, phytochemicals influence health by altering genetic expression. That's nutrigenomics. We're looking at things like biochemical individuality. We're all unique. We're all unique individuals. So we're all operating with our own unique biochemistry. And that can show up in a variety of ways. To tie that into genetics, like we all have what are called SNPs. So these are single nucleotide polymorphisms. So they're just where particular enzymes or genes may not function adequately. So a classic one that people are becoming more and more aware of is MTHF. And that's where people can't convert folic acid into its active form in the physiology. That's about a third of our population. So those people who have that genetic SNP might need to take more folate than somebody who doesn't have it. So we can't say that everybody needs the same amount of nutrients because we're all unique. And so that's, so those are just some of the things that would separate somebody who's doing integrative and functional medicine from somebody who's doing allopathic medicine. And in addition to the fact that integrative and functional medicine practitioners are also going to look at, not only are they going to look at genetics and genetic SNPs and biochemical individuality, but they're also going to look at your environment, your home environment, your work environment, your community. They're going to look at, what was your birth experience like, your childhood, medications you took during childhood, right? They're doing the work to develop your timeline. What is your bio? What is your health biography? And that includes your lifestyle as well. So your sleep and your exercise and your stress levels or stress management or lack of stress management. They're taking this all into consideration. And in doing that, then what they're going to do is, we get this timeline of a person. And then what we begin to do is encourage the removal of barriers to health, remove the obstacles to cure so that the body can heal naturally. And the way that we do this is we focus on the most natural and least invasive methods possible before the more costly and more invasive methods. And one of the ways to do that is you have to look at the human being as we are a system of systems, right? So, and all the systems are interconnected, just like a spider web. So we look at the interconnectedness of all the systems, and we create this systems approach to healing due to this web-like nature of the human physiology. So we started addressing it from systems, and we're taking into consideration the interaction between our genes and our environment, and our environment and our genes. And then we're viewing health not just as the absence of disease, but as sustained positive vitality. So we're looking at the promotion of organ reserve. We're looking at, how do we sustain vitality? Health isn't the absence of disease. Health is vitality. And so that is, if we're looking at integrative and functional medicine, that's what separates integrative and functional medicine from allopathic medicine, whereas allopathic medicine, as many of us have experienced, is a very condition-oriented system. You have a symptom, we will treat the symptom. We're not going to dig deep to find the root cause of the symptom. We're just going to treat the symptom. And that's really tricky because, let's just take something like elevated cholesterol. Well, cholesterol isn't the issue. Cholesterol is a symptom of an issue, right? And so if you're just treating cholesterol, then you're missing the root cause. Is it blood sugar dysregulation, insulin spikes because somebody's spiking their blood sugar all the time, and that causes a shift in our lipids and our lipoproteins. And so, is it that their thyroid is under functioning, and so that they got sluggish thyroid, so the cholesterol starts to go up because their metabolism is slowing down? Is it the gut microbiome? We could go on and on and on. But so whereas allopathic medicine is a very see symptom, treat symptom system, integrative and functional medicine is what we would say root causes medicine.
Yeah. And that's kind of where I am in mental health. When people come in to see me for anxiety or depression, those are the symptoms. And then I want to know how they got there in the first place. What is the root cause of the anxiety and depression? What are the traumas, the unhappy moments? What are the belief systems? What is the lifestyle that created this that you're bringing into? So yes, we'll treat the symptoms, but I want to dive deeper and find out what caused this in the first place.
Correct. And, and this is a great example of where, using bringing a functional perspective and diving into the physiology from a nutritional standpoint is really important in mental health as well, because we now know that our gut microbiome is responsible for producing neurotransmitters like GABA, which is an anti-anxiety neurotransmitter, right? And if your gut microbiome is in what's called a dysbiotic state, or a state where that is characterized by low species diversity of bacteria in the gut and inflammation, then you get reduced amounts of serotonin, reduced amounts of GABA, reduced what are called short chain fatty acids, which are signaling molecules from the gut to the brain via the vagus nerve. And so, so there's the gut brain dynamic that we're becoming well aware of now, that influences our mental health. So the state of our gut actually influences the state of our mind.
Yep.
Right? And if you're not addressing that as a mental health practitioner, then you're missing a huge piece of the puzzle.
Oh, how well I know. One of the things I always ask people when they come to see me is get a baseline of your vitamin D level. Because I practically guarantee that if you're suffering from anxiety, especially a low mood or depression, I practically guarantee that your vitamin D level is low, especially in Western Pennsylvania, where today's a sunny day. What a concept. But usually we have cloudy days or rain. So how is a person supposed to get enough vitamin D, which affects their mood?
Right.
So some people do that. I had one young lady who, I'm miserable. She finally got her vitamin D level and it was really low. Then she started to take Nordic Naturals vitamin D3. Her mood increased dramatically. And I was working a long time ago with a physician who was going through her residency. And I said, will you please get vitamin D levels on all your patients? So she has. One of you doctors, anyone listening out there who is a healthcare provider, will you please get vitamin D levels on your patients?
The vast majority are deficient.
Yes, amen.
Yeah, I mean, the research shows the vast majority of Americans are deficient in vitamin D. So.
Yep. And then that's what will contribute to the depression and the low mood. So for everybody who doesn't want to take an antidepressant, I want to say I am not against medication. So it's needed. But I will say, I think people could try some, as long as they're not having suicidal thoughts or a danger to themselves or others. There's some other things that can be tried first.
This is coming back to what we were talking about, the tenets of integrative and functional medicine being trying the least invasive first. Let's this I always compare it to cooking with salt. You always start with less and you add more as you need. You don't start with a ton of salt because it's going to ruin the recipe, right? Why not start with a little, with less and work up to more?
Just a little pinch until you find out.
Most people just need little changes, and it makes a world of difference.
Oh, beautifully said. Beautifully. The question I always get, where do you find a functional provider? Because I'm blessed. I have a functional physician, a chiropractor, and a doctor of Qigong medicine. And before they licensed naturopaths in Pennsylvania, he called himself a naturopath. But since licensure, he's not allowed to call himself a naturopath. But that's another story. So that's my team.
Great team.
Yeah, whenever I have a test from my functional physician, then I send it on up to my Qigong doctor, and he says, Joan, you have nothing to worry about, or Joan, I think we're going to try this. And I go, okay.
Excellent. Yeah. We all need a team, that's for sure. The greatest coaches have coaches. And so, we all need a team. And so the easiest way to find a functional medicine doctor would probably be to go to find somebody who's been trained by the Institute for Functional Medicine. And I believe their website is ifm as in Mary .org. I think that is their website, but you can Google Institute for Functional Medicine. Go to their website and they'll have a locator, a physician locator, and that will provide all the physicians that have been trained in their program. Now, there's a whole realm of new functional providers coming out, functional nutritionists, and so which I'm a functional nutritionist. And and nutrition is seeing a resurgence. It is having its day in the sun right now. And I'm really happy to see that. And functional nutrition has been a huge part of that movement. And so you can find a functional nutritionist. Now, they can't do the same things that a functional medical doctor can do, but they can do a lot of really wonderful things, and they might be less expensive. So that's, if cost is concerned, you can find an integrative or functional nutritionist and get a lot of amazing work done that way also.
Okay. So Judah, are you taking on new clients?
As a matter of fact, Joan, what I have done is I have created a functional metabolic and lifestyle reset. And so what I do is I take people through a 10-week journey to shift their metabolism and shift their lifestyle in a way that helps them reach their true set point for their metabolism. And so shedding excess weight, excess weight mentally, emotionally, physically. So what I do is, it's either you can be a part of a group, or it's an individual, or you could work with me one-on-one, and we just walk you through 10 weeks to optimal health. So it's a specific diet that I've created. There's no pills, no powders, no potions. This is strictly diet and lifestyle oriented, because I believe that's a great way to it's a great way for people to know that they can make the changes they need without external forces.
Wow. So
it's all inside
get a
us.
hold of you, and second, then how would they also research a functional nutritionist?
So you can find me at earthspiritnutrition.com. My website is currently being revamped at this time, but if you go there, you can get my morning routine. This is what I do every day when I wake up. It's how I start my day. And so you can get my morning routine and benefit that way. And then you can stay in touch with me that way.
Yeah, I signed up for it.
Oh, awesome. Fantastic.
And I have my big water pitcher in the morning. Here, let me get that on there. So I drink my water in the morning now and do the other things that you recommend. It's fascinating. And then any specific place that people should go if they're looking for in the
like a functional
event, they can find somebody in Western Pennsylvania, but where would they?
You know what I would do? I mean, the easiest, Google is the all-knowing search engine anymore. And I think what the easiest thing to do would be to Google functional nutritionist or functional doctor, or functional medicine practitioner near me, and see what comes up. And then you just start to check, and then do your research, see what their background is.
Okay. And what I want to explain to people here is, okay, we are of the mindset that insurance should cover everything. And that's not necessarily so. So sometimes you're going to have to invest in your own health. I'm not talking hundreds and thousands of millions of dollars, but sometimes you're going to have to invest maybe a few $100s to find a functional and integrative expert in your area, because these folks don't take insurance. Okay. for a variety of reasons of which I'm not going into right now because I'm very grounded. I'm not going to go into those reasons, but they don't.
Right.
So it's the way it is in the United States. You're not necessarily going to find this expert through your insurance. So you've got to be willing to invest in your own health. I do. I have my own doctor of Qigong medicine and naturopath, and I do. And he's very, very reasonable. Okay, just saying.
Yeah. Well, you know, and just to add to that, you know, a practical part of that is, you know, the cost of not being healthy is significantly greater than
Yeah.
what it costs you to go to a functional nutritionist or a functional medical doctor. Right. So that's the thing. We're in a time where people don't realize that. But the cost of lack of health is significantly greater to you. I mean, a person with diabetes will spend on average 10 grand a year on
Wow.
medications and stuff like that. So think that's out of pocket besides what their insurance will cover. So we have to take that into consideration. Like the opposite of not being healthy is significantly more expensive than investing in your health.
Wow, so well said. Yeah, what was how many co-pays have you spent this year? Okay, we won't go there. But think about that a little bit.
Mm-hmm.
Such important information. I have learned so much from you today. Is there anything else that the world should know about functional and integrative nutrition and care versus allopathic? I think we have it covered, but you're the expert.
No, just do your research.
Do your research. Yeah.
Do your
Ladies
research.
and
And
gentlemen,
also, don't be afraid to set boundaries. So the most common complaint I hear from people who see a functional practitioner is the amount of supplements they have to take. And I understand that. I've counseled people. I've been in the supplement industry for a very long time. I've worked with people who've brought me bags and boxes that they're taking. And I understand that, not because of a functional medicine practitioner, but usually because they read something and they think, oh, I need that, and they order the product, and then they read something
yeah.
else,
What a
and they,
waste.
and they're
Yeah,
self-diagnosing, right?
yeah.
And they're not seeing a professional, so they're spending a ton of money. They're not getting a targeted approach, right? So
Right.
anytime you go to a new doctor or a new practitioner, you get to interview them. They're working for you. I would just be very clear about what your intentions are, what you're needing, what you're wanting, what your boundaries are. Not too many. If you can only do 4 supplements or 5 supplements, tell them that. Just be really clear up front, and that gives them the information they need to continue to personalize your care. So
Beautiful. And I will add, if you're lucky enough to find someone who does applied kinesiology, which is measuring the energy of the supplement according to what your body needs, that'll cut through that immediately. They can do applied kinesiology, also known as muscle testing, to see what you need and how each supplement, and even according to their training, knowing how to integrate pharmaceuticals with supplements, also being able to know what supplements work best together. Now, I've been doing my own muscle testing for 50 years, so I do it myself. But if you're lucky enough, you can do that. But absolutely, what Judah said is so true. Just set your boundaries, try a couple of things and see how you feel. And, get the data, get the blood work to see, get a baseline first, and then get the blood work. And I am so going to reach out and get my omega index test because I want to see my omega fatty acid.
it's called Omega Quant.
Omega Quant. Oh, cool beans.
Yeah.
But anyway, yeah. So just Judah, amazing. Thank you everyone who's listening and watching. This is such important information that I have been wanting to get to you for so long, but hadn't found the expert until now.
I'm so glad that it was me and that I got to be here with you today, Joan.
Oh, thank you. You're so kind. So everybody, here's the information. I'm getting it out to you. So take what works best for you and leave the rest behind. And I thank you so much for listening and watching. If you have any questions about counseling or clinical emotional freedom techniques, contact me. And Judah, thank you so, so much for your time today. This is unbelievable.
Oh,
Whoa.
you're so welcome. You're so welcome. It's been an absolute honor and pleasure to be here today.
So bye-bye, everybody. See you when I see you.